Okay, and we're live. Hi, everybody. Thank you for joining us on our YouTube channel today. My name is Kyle. I'm the project coordinator from Protect PT, and I am joined by the Environmental Health Project today. And today they will be talking about two of their tools, one of which is a local air quality tool to help you understand the air quality in your local area. And the second will be an education tool about the compounds, some of the things you may find in the air. So without further ado, I'm going to hand it over to EHP here, and I'll hide my camera. And thank you guys for joining us today.
Thanks so much, Kyle. Hello, everyone. Thank you for joining us. Kyle, I just sent a request to be able to share.
There you go. Apologies.
Great. All right. So my name is Nathan Duran. I'm the program manager at the Environmental Health Project, and I am joined today by Sanjana Parmar, our environmental data analyst, and Jackson Zeiler, our public health analyst here. And as Kyle mentioned, we're going to be talking a bit about two of our tools. So just a bit of an agenda here. I'm going to give you a brief background about the Environmental Health Project, and then we're going to dive on into these two demonstrations. First, we're going to be looking at AirView Public, the air quality analysis tool. Sanjana will be taking us through that. And then Jackson will take us through the compounds of concern demo as well. We expect to take about half an hour to get through our content, maybe a little longer than that, and leave any time for questions that folks might have. So to get us started, I want to give anyone that isn't familiar with the Environmental Health Project just a brief background about our organization. EHP was founded in 2012 as a public health nonprofit organization, and we defend public health in the face of shale gas development. So we do that in a variety of different ways and in a lot of different places, as you can see on the map to the right here. We were founded originally in southwestern Pennsylvania, in Washington County specifically, to address the large amounts of uncertainty surrounding the public health impacts of the shale gas boom when it was still in its early stages. But now there's a lot known about the impacts of shale gas development and oil and gas development more generally. So our current work falls into three broad categories. The first is data collection and analysis. The second is health and wellness education, and the third is policy and advocacy initiatives. Much of our work is done in partnership with community organizations like Protect PT. We have a small but mighty staff of about 10, and we cannot be in all of these places, right? We really rely on community organizations that really know and understand the places that they live and work in to get our tools out there, right? One of the main ways we do this is through our Health Watch program, which is what many of these dots on the map are, where we provide air quality monitors to communities that are concerned about a particular facility that could be impacting air quality and public health in their area. If anyone's interested in the Health Watch program, you can go to our website, environmentalhealthproject.org, and fill out an application if you would like to get involved. But with all that said, a lot of our work has historically been focused around shale gas wells, which is what we're seeing here, fracking wells, right? But that's not the only kind of infrastructure that's important to work around and that we have worked around over time, right? We have things like compressor stations, power plants, petrochemical facilities, and end-use waste, end-of-life waste facilities as well, that really encapsulates the whole life cycle of shale gas. So we work around a lot of these different kinds of facilities with Protect PT. We currently have monitoring projects around injection wells and the Westmoreland sanitary landfill, as well as some other local polluters. But we're not just focused on the fracking. We're focused on all different aspects of the shale gas life cycle. So one of the main ways we do our work is through air quality monitoring, right? The monitoring that we do does have an oil and gas focus, and it is facility specific generally. So we tend to look at a specific facility of concern to surrounding community members and try to understand how much that facility is impacting the air quality and the health of the surrounding community. About, okay, how long are they happening for? And where are they potentially coming from? Is it coming from the facility that the community is concerned about? Or are there other emitters in the area that we want to also be aware of and perhaps be able to point to using data that we take in besides just the air quality monitor data itself? This is important because Sanjana is going to show one public-facing version of how we provide this kind of monitoring data for communities for analysis. But another thing that we do a lot of, as I mentioned, is health and wellness education, right? And across this whole process of extracting, moving, using, and disposing of shale gas and associated products, there's a lot of different compounds that can get released into the air. And some things are, relatively straightforward, but many of these compounds are not very familiar to people. So the second tool that we're going to be showing today, Jackson's going to be showing the compounds of concern tool, which really tries to make the data that related to the public health impact of these many different compounds, make it accessible and easy to access and parse for folks that aren't doing this kind of work day in, day out like we are. So with all of that, I am going to now pass it over to Sanjana for the AirView public demonstration.
Thank you, Nathan. Just give me a minute so that I have a setup. All right, can you see the app on the screen?
Yep.
Thank you. Hello, everyone. Thank you for giving us the opportunity to share AirView Public with you. It is a free online tool designed to help you visualize and explore local air conditions in your community. The platform responds to the questions we hear most often. What is in the air I'm breathing? Where is it coming from? And what can I do about it? AirView Public brings together 3 layers of information: air quality data, weather insights, and pollution dispersion modeling, and to give you near real-time information about pollution levels and what might be influencing them. So let's begin with our monitoring tab. Here, let's begin with selecting a community. Today, we are going to look at Mon Valley. Next, you choose the pollutants that you're interested in. Today, we are going to look at both PM2.5 and volatile organic compounds. You select a date range, which goes max up to 8 days in the past, and then click Run Analysis, which dynamically updates our visualization. On the right, you see a 15-minute average monitor readings over time. Each line represents a different monitor location within the community. This layered view answers the question, what is in the air you're breathing? You can see when the readings rise or fall across the time window, whether pollution spikes are community-wide or localized, and whether there are any recurring daily patterns. You can select any of the monitors given here below to appear or disappear, isolate their impact on the readings. We also provide some additional options. Now, if you select the modeled impact of facility, we display when a selected facility may be impacting each monitor based on a pollution dispersion model called the high split modeling system. When a monitor is being impacted by emissions from a facility, its readings appear as solid lines, as you can see here or here. When emissions from a facility are not modeled to reach a monitor, the readings appear as dotted lines. Next, we have show weather dispersion. What this does is this colors the background of the plot based on 5 categories of atmospheric dispersions, ranging from very low to high. At lower levels of dispersion, pollutant events may dissipate more slowly, and ambient pollution levels can accumulate. At higher levels of dispersion, pollution levels tend to drop more quickly but travel farther. And you can see all of these described in our legend. This allows you to visually connect pollution spikes with atmospheric conditions. And then we have a third option called adjust scale for multiple pollutants. If you're analyzing more than one pollutant at a time, what this does is normalizes the scale so you can better compare pollutants that are measured in different units. It's like bringing them all to the same scale without actually impacting the data. Now, let's move on to the Measure tab. This section helps us summarize what those readings mean in context of EPA standards. We provide different monitor categories for each different pollutant, which are represented right at the top. We also, while this is loading, let me tell you about our example outputs. Each tab has its own example outputs and the description of what it means. Looks like we have our output ready. Okay. In this view, we're looking at the summary table that shows 2 key metrics for the selected time frame. The first column shows 98th percentile of 24-hour reading. This represents one of the highest daily average readings recorded at each monitor during the selected time period. The EPA uses 98th percentile of 24-hour averages to evaluate its daily standard for certain pollutants, including PM2.5. It is important to note that EPA standards are officially evaluated using 3 years of data from high-quality regulatory monitors. Because every public displays a shorter recent time window, this data cannot be used to officially determine whether a standard has officially been violated. Instead, this view helps you to understand how current readings compare to regulatory benchmarks. Now, the second column shows the average of all readings for each monitor during the selected time frame. This is simply the average concentration across all measurements within the chosen date range. This metric relates conceptually to the EPA's annual standard for certain pollutants, although again, EPA evaluates annual standards using long-term multi-year data sets. Now, let's look at the AQI category for frequency analysis table. Here, you can select different AQI categories, such as moderate, unhealthy for sensitive groups, unhealthy, very unhealthy, and hazardous. The table shows how often 15-minute monitor readings entered or exceeded that selected category during the time period we have selected. For each monitor, we display the number of days where the readings exceeded the selected threshold, the total number of days with data, and the percentage of days above the level. This allows you to see how consistently air quality entered that AQI category across different monitors. The any selected monitor row, which is right here, shows whether at least one monitor entered that category on each day, which helps capture community-wide patterns. At the bottom, we provide a brief context statement tied to the selected AQI category to help connect the data to what it means for public health perspective. Like here, at a moderate AQI level, fine particulate matter exposure poses no significant health risks for general population. But if you were to select, say, one very unhealthy, it will tell you what that exposure could do. It could aggravate heart or lung diseases, increase premature mortality risks in vulnerable groups, and causes substantial respiratory effects in general population. Now, let's move to the attribute. This section helps us explore a different question. This answers the question, where was the air coming from when those highest readings were recorded? The map shows where the air came from when the 10 highest hourly readings were recorded on a selected monitor. Each colored line traces the approximate path that an air parcel took to arrive to a monitor site based on weather modeling. Now, if you were to select any one of these dots, they're all placed 1 hour apart. It will give you the following 3 pieces of information. One, when the air arrived at the monitor. Second, where it was 1 hour earlier. Third, and what the pollution reading was recorded. It also gives you height and pressure information at that particular monitor. But how it is represented is as the height increases, the line becomes lighter. As the height decreases, or the packet is closer to the earth, the line becomes darker, as you can see. This connects high readings to air's travel history. If multiple high readings show passing over the same upwind area, the pattern may be meaningful. Now, this tool helps you identify potential upwind areas that were along the air path during such an phenomenon. If multiple high readings come from different location, that suggests different influences. Next. At this point, if you and I were sitting across the table from each other, I would ask you if you have any questions for me. But we have a chat feature available. If you have any questions, please reach out. Just to summarize this all again, every public, we moved through 3 key questions. What were the pollution levels? How do they compare to health and regulatory benchmarks? And where was the air traveling from during the highest readings? By combining monitoring data, weather context, and dispersion modeling, we provide communities with transparent and accessible insights into local air qualities. You might have some questions when you navigate through this platform. Please go on and go to our resources page. It has a lot of information available for you, but you're always free to reach out to us via an email, or you can leave a feedback. Or if you have a community where you have monitors available, reach out to us. We're adding those monitors to our platform. With that, I will pass it over to Jackson.
I'm happy to take that one. So yeah, they are sort of 2 sides of a coin, right? Where one isn't obviously always better than the other. You're right that when dispersion is low, when the air is still, it's a little more obvious, perhaps, that there is increased harm because pollution can accumulate near its sources, right? And with high dispersion, there's a lot more movement in the air. Now, sometimes that movement is a lot of turbulence that serves to really spread out pollution over a larger amount of air, which means that at the end of the day, people are exposed to less pollution. So if one is better, it tends to be high dispersion is better. However, there are certainly situations where the air is moving in such a way that the pollution doesn't really sort of disperse into a larger volume of air, but simply moves somewhere farther away, right? You can get this streaming effect of plumes of pollution coming off of emitters that then don't really dissipate all that much, but do travel far under high dispersion conditions. So usually high dispersion is going to be better, but not always. And it depends a lot on topography. It depends a lot on the specific emitters and where they're located. But even if you're sort of far away and getting exposed to pollution from a faraway source during a high dispersion situation, that is going to be pollution that will sort of come and go more quickly than if the air was still. So I guess worst case scenario, if you live far away from an emitter, is it gets sort of blown to you and then gets stuck there during a low dispersion situation. Really, when we're looking at these dispersions, a lot of the interesting analysis comes from the changes in dispersion, right? So you can see often that pollution is accumulating during those low dispersion times. Many of these monitors in this tool are placed near emitters. So you can see low dispersion, pollution is sort of building, and then as soon as dispersion goes up and there's more turbulence, more movement in the air, it just drops and goes to a much lower level of pollution in the air. So those changes are often where we see patterns that help us understand, okay, what kind of dynamics are at play here? I hope that answers your question. If by components you mean pollutants, then we're talking, this largely includes particulate matter, PM2.5, and volatile organic compounds, or VOCs. This is largely dependent on what kind of monitors we have access to. So if you have monitors in your community that you want to get into this system that track other pollutants, by all means, fill out the form that is on the Contact Us page, and we'd be happy to add them in here and get you access to this system.
Great, thank you. Let's share it here really quickly. Alrighty, okay, so switching gears to our other tool that we wanted to show today. Just before that, I'm Jackson Zeiler, as Nathan said, the public health analyst here at EHP. The other tool that we have released last year is this compounds of concern tool. And then just before doing a demo, wanted to run through a little bit of background just because it helps to contextualize and better understand the tool and kind of what you're looking at. So what we'll cover, what it is, why we need this tool, how we created it, kind of our methodology. I'll do a demo and then any questions about it. So what is the Compounds of Concern tool? It's an interactive database of now over 60 air pollutants, mainly from industrial emissions, with the health and exposure information appended to it for easy access. So we set out to take compounds and their health and exposure information from many disparate databases and sources and compile them into one tool instead of you having to look in various places. So this uses publicly available peer-reviewed data to make all that toxicological information accessible into one streamlined format. Then it also allows you to search by a specific chemical or an organ system or an endpoint health effect, and identify a lot of those health risks. Why do we need the tool? We know that these polluting industries emit various compounds and hazardous air pollutants, from PM2.5 to VOCs to polycyclic aromatic hydrocarbons. We also know that in combination with other factors that these pollutants contribute to ground level ozone. These five kind of categories are not exhaustive of what these compounds come from. However, it's where the majority that we found do. So just kind of a quick reflection of what facilities these compounds will mostly be found coming from. We also know that these pollutants have a demonstrable effect on health of nearby populations. but we don't know what they always are. So these, in permits for these facilities, sometimes we get, for example, a facility saying that they're going to emit a lump sum of volatile organic compounds, largely as a category, but they don't delineate which exact VOCs they are. So this will hopefully help to characterize better what those pollutants might be, either by kind of tracing their health effects or where they're expected to be emitted from. Um, and so, yeah, this helps to better understand the exposure risks in that way. Without getting too exhaustive as far as the methodology, there is a section where you can check out our full methodology if you desire. But essentially, the main tools that we use, the main databases for our evidence was PubChem, ATSDR, toxicological profiles for individual compounds, and the EPA's integrated risk information system. And so each of these tools, each of these areas has information that another one doesn't. But the tool that we've created brings that all together so that you don't have to read through an entire toxicological profile just to get the symptoms, and then later compare it to a minimal risk level that you find in the IRIS system. It's all just there in one convenient window. And so then here on the right side, just wanted to highlight what the tool kind of tells you, and what it might not tell you also. So we get short and long-term health effects and all our target organs that are affected, everything from carcinogenic potential to the reference concentrations where available, and everything like that. So we'll transfer my window over here. So to get over to, I'll just do this demo now. To get over to our compounds of concern tool, you can navigate to the Environmental Health Project's homepage, go over to tools, drop down menu here, and then just click on compounds of concern. It'll load up the tool with a medical disclaimer, similar to the AirView one, that this is just educational and is not a tool to be used for diagnosing any health conditions.
Hey, Jackson, I'm still seeing a slide here.
Oh, sorry about that. So, there we go. All right. Just reset here. So homepage, tools here, and then clicking compounds of concern. Here's our medical disclaimer. And then this is the tool itself. Three little buttons here. I'll go first through the tool itself. So you can get into the tool by clicking the big green button, and then you'll be greeted with these kind of four main sections. And essentially what you can look at these as are different filters that will filter down to the compound that you might be interested in. And there's various ways to kind of get the information that you're interested in. So we'll just start with this, top left quadrant here with the human body. These each kind of represent different organ systems that you might be interested in filtering by. So maybe you kind of set out with the goal of understanding what compounds in our tool are going to affect like the lymphatic system. So it'll just narrow down in our list of 60 plus compounds here, which of those target the lymphatic system. These will not be only that will not be the only system they target, but if it is included as a target system, it'll show up here. So we'll just keep going with arsenic here as the one to look at. So you could just also click over here and switch the compound, and it'll switch it in the right window over here as well. But kind of continuing on with arsenic, each of these is a drop down sort of menu, so you can kind of expand everything as you go. But the first one will be what other target organs are affected here, and then the one that you selected will be highlighted. So we chose lymphatic system, but it also is affecting all these other systems as well. For the list of symptoms, this is going to be taken again from that ATSDR database of toxicological profiles. So these are the most definitive health effects and symptoms to be expected from the literature and from the research that we understand. These are all going to be symptoms of that particular inhalation exposure to that compound. And I did say inhalation exposure. Sometimes there's other pathways of exposure if this compound is deemed to be um, dangerous to via other pathways. This one also has dermal, but most of them, since we set out initially to look at inhalation exposure, that will be the majority of what you see here for the pathways. This health risk section is going to give you information on if the compound is carcinogenic and also the reference concentration or minimal risk level. So these might be important to you if you have actual output of compounds from air monitoring or something like that, and you want to compare it to an actual, health value, a value that's, expected to create health effects if exceeded. So a reference concentration for a chronic exposure that's 365 days or more daily exposure to this compound of 0.00015 is very low. So this is a very dangerous compound to be exposed to at even very low levels. If you had output that was less or more than that, you might be interested in comparing those values. And then not all of the compounds that we have in the database here have these values. Some of them are very understudied or not well characterized. So we try to provide the most information that we can here. We'll pretty much only put a value here if it's been studied and determined by an agency like EPA in the past that has a value already. So if it's kind of one research paper kind of marginally on the side saying that there's a effect at this level, we probably won't include it there, but we try to keep this as inclusive as we can. These sources will kind of tell you where this shows up in the industrial stream. So what it's used as in the industrial process, and then what sectors it tends to show up in. This is all from PubChem. They draw on a lot of these industries have to report that they're using a compound, so they draw on that information to kind of definitively say where that's being used. So that's a good way to find the facility source. If there's consumer uses for a compound, they'll show up under uses. Arsenic does not show up, thankfully, in many consumer products. Our evidence here is just going to give you links to the IRIS database profile and the ATSDR tox profile. So that will link outwardly to more information if you need it, as well as the chemical identifying number, if you also needed that. And then each compound will also have this glossary of terms, which is pretty exhaustive. It kind of gives you an idea of what you're looking at. If you had a quick reference question on what you're looking at here. So another way we can kind of just reset everything by clicking reset. Another way you might approach the tool is like you already know the compound you're interested in. Benzene is a good one, common in a lot of EHP work. So you'll change it up here again. You'll get all the same information as before, but that can be one way to kind of categorize and search that way. If you already know the compound that you're interested in. Sometimes the reset doesn't work. Just refresh. Back in here. The final kind of way I would approach the tool is going down here to our filters. So maybe you're just interested in specific symptoms. Like dizziness, I think, is one that comes up a lot of these inhaled compounds. You're interested in dizziness, you can also filter by the source, the industrial source. So we can do any compounds that have a symptom of dizziness and there's related to oil and gas drilling. And then I also want to know which ones are carcinogenic. So that'll really narrow down the list of those compounds that are have symptoms of dizziness, are used in oil and gas operations and are known carcinogens. Um, and so that can really narrow down if you don't know where to start really with the compounds, and want to get a shorter list. The final thing I'll kind of highlight here is that you can render a report by just clicking render report here. Um, It'll take a couple of seconds to think about it. Okay, I did download this earlier, I think. Either way, it does come up with a report that is more like a printer-friendly version, I would say, that you can, take to a doctor or even to like a like a policymaker to better understand and help them better understand each individual compound. But it will have all the same exact information that's on this database, just in like a more readable format. Uh, is that showing up the report here?
Yep.
Okay, sweet. So yeah, all that same information, just in a more, I guess, like I said, legible, printer-friendly format. Last thing I said I would do is go back over here to the homepage. There's a couple of resources at the bottom. The contact us is going to give you like our email if you have general questions or suggestions. We do have a feedback form that once you use the tool would be great if folks could fill it out to give us a little bit of feedback on what you'd like to see added or features that aren't very useful for you or something like that. But then the last one I wanted to highlight was add a compound feature. So we are adding compounds, usually one per week, trying to target like 4 per month. And we're really just going based off sampling that we're getting now or output from different, sampling techniques that we have, or lists like TO15 lists and different kind of regulatory bodies providing lists of compounds that are dangerous. We're just kind of working through those lists, but if community members suggest a compound that they'd like to see, we usually just pop it to the top of our list so that we can add that quickly. So if there is a compound on there that you didn't see that you would like analyze and like added to this, we'll prioritize it if you still have this form. The other kind of thing here is the resources area, which is what I was mentioning before, is like our full methodology. So if you did have a reason to kind of look at how we did everything, you can check this part out. That kind of brings me to the end of the demonstration. And yeah, can you answer questions about that or other things that EHP does?
Yeah, well, that is everything we had prepared. So I do have some contact info here. Oh, great. Pop it up on the screen. So yeah, thanks everyone for taking the time to join the Lunch and Learn today. If anyone has any questions about any of the things that we covered here today, you can go to our website at environmentalhealthproject.org. You can call our office at the number listed on the screen. And if you want to reach out to any of us in particular, our email addresses are on the screen, our first initial last name at environmentalhealthproject.org. We always love to get feedback about these tools, hear about how people are using them, and understand, use cases that people have for our resources. So if you have anything that you want or are willing to share with us, we really appreciate that. As both my colleagues mentioned, we always are working to improve these tools and make them as useful, accessible, and meaningful as possible. So any feedback you have is greatly appreciated. And I'll just end with a big thank you to Kyle and everyone at Protect PT for having us. Really appreciate getting the opportunity to share these resources with folks on your platform here. So thanks again for having us, and look forward to working with you more in the future. Okay. Yeah, so most of the data that's in Interview Public is from places where we have existing relationships and have, done monitoring projects with monitors that are still online. We've done work in the Southwest, but it was a long time ago, and those monitors are long offline. So if you have monitors up in Texas that you want in the tool, you can, fill out the form on the tool itself, or just email us if you want, and we'd be happy to put them in there for you. This is meant to be as accessible as possible, and we have no problem putting other data feeds in there. So there's nothing stopping us from adding something from Texas, and we will be having the addition of our first network in Louisiana coming up shortly here. So we are starting to get some data from that part of the country in the tool. Thanks all.